Hi, I am Dr. B.K. Madhusudan, Lead Senior Consultant Neurologist, SPARSH Hospital, Yeshwanthpur, Bangalore, and my colleague Dr. Kishore Kota is a Pediatric Neurologist, SPARSH Hospital, Yeshwanthpur, Bangalore. Today, we are here on the occasion of World Brain Day. July 22nd of every year is celebrated as a World Brain Day, and the theme for this year is Brain Health for All. That means the brain should be healthy for each and everybody to lead a normal life and a good quality life. So, what are the common conditions that affect the brain health that you should know is majorly it is the those patients who are having or those persons who are having the diabetes, hypertension, heart disorders, and patient who are suffering from Alzheimer's disease, stroke, depression, traumatic brain injury, and sleep disorders. These are some of the common conditions which affect the brain. So, before going to the details of those things, first you should know what is brain, how much is the weight of the brain, and how many cells are there. So, brain is a very important and vital organ in the body, and it is one of the important organ in this biological evolution. And it weighs about 1.5 kg. It contains around 100 billion cells called as neurons. Each and every cell of the brain is called as a neurons. You know how much of the neurons are there in each person? 1% neurons, if you wind around the earth, it can wind about 4 times the earth diameter. That means that much amount of neurons are present in each person. So, what is brain health? Human brain is the command center of the nervous system and enables thoughts, memory, movement, and emotions by a complex function that is the highest product of biological evolution. The American Heart Association and American Stroke Association defined optimum brain health as the average performance levels among all the people at that particular age who are free from the known brain or other organ system disorders in terms of the function levels or as adequacy to perform all the activities that the individual wishes to undertake. So, brain is a complex organ and it has at least 3 levels of functions like interpretation of the senses and controlling the movement, maintenance of the cognitive, mental and emotion processes, and maintenance of the normal behavior and social cognition. So, as I told you earlier, the most important diseases of the brain are the one important thing, vascular disease, that is the stroke. Next is the neurodegenerative disorder called as the Alzheimer's disease. Then the injury that may cause damage to the brain called traumatic brain injury disorders. Then the sleep disorders which can affect the brain. Other disorders which can affect the brain are patients who are having the heart problems, diabetes and hypertension can affect the brain in various ways. Coming to the first most important disease which is affecting majority of the patients all over the world is the stroke. Stroke is nothing but the damage to the brain which is caused by sudden onset of decrease in the blood flow due to the blocking of the blood vessels or the rupture of the blood vessels which can damage the brain. So, many of the patients, around 1 million patients are suffering from stroke in India itself, especially around 10 to 15% of the people belongs to the less than 40 years of age, that is called as stroke in young. And majority of the stroke are ischemic stroke, that is around 83% and 83 to 87%, and around 13 to 17% belongs to the hemorrhagic stroke. So, what is ischemic stroke? It is the blocking of the blood vessels which can cause damage to the brain, that is called an infarct, that is the ischemic brain injury. So, various types are there. It may be because of the large vessel occlusive disorder, or it may be a small vessel getting blocked, or it may be a cardioembolic event, or maybe some unidentified causes. So, coming to the hemorrhagic stroke, it may be a subarachnoid hemorrhage, it may be a subdural hematoma, and these are some of the hemorrhagic strokes which we are speaking about. There are two important risk factors in this, the modifiable risk factors and non-modifiable risk factors. Non-modifiable risk factors are age, sex, and if there is any previous history of the stroke or family history, they are all the non-modifiable risk factors, whereas the modifiable risk factors are smoking, hypertension, diabetes, heart disorder, sickle cell anemia, hypercholesterolemia, or it may be hyperhomocystinemia. These are some of the non-modifiable disorders, and decrease in the physical activity and obesity, and these are sedentary lifestyles are also modifiable risk factors. Coming to the second disorder, that is the Alzheimer's disease, that is called as dementia or Alzheimer's disease. This is the problem in the memory. The majority of the patients have got a decline in the recent memories. However, the remote memories are good in these. What some of the risk factors are age, genetic factors, environmental factors, and the lifestyle changes are some of the risk factors for in this disorder. The next important is the traumatic brain injury. That is due to, that may be because of the road traffic accidents, patients not persons not wearing the helmet and driving the vehicles, not taking the safety precautions during working in some of the constructive places, patients who are alcoholics and who are having the balancing problems, they may have a tendency to fall and they may have the head injuries. So, these are some of the risk factors for the head injuries or traumatic brain injuries. Some of these sleep disorders also can affect the brain, like obstructive sleep apnea. Here, what happens? The patients who are obese, who are having the problem in the breathing, their lifestyle may be very sedentary, and these people are also at a risk of neurodegenerative disorders. They are also at a risk of stroke. Some of the other few important disorders commonly we see is the headache, that is migraine. Majority of the patients who come with a off-sided headache, or sometimes they can have the headache only in the frontal region or occipital region, or it may be olecranial headaches. These patients may be suffering from the headache, and the quality of life may go down, and majority of the patients will be having the pain, and because of which they may not be able to do the work to the highest level of performance. The another important disorder in the neurological subject is Parkinson's disease. This is one of the important movement disorder. This is due to the accumulation of the abnormal protein in the brain neurons, which leads to this disorder called as a Parkinson's disease, where the patients will have rigidity, resting tremors, unsteadiness of the gait, falling tendency. These are some of the important things which these people will suffer. So when it comes to the prevention, you should know that what are the things you can do to prevent all these disorders. See, some of the disorders are preventable, some of the disorders are treatable, and you can prevent majority of the brain disorders if you take a proper precautions. So 6 pillars of brain health you should know. What are the 6 pillars? One is the physical activity, second thing is the mental exercise, third is the healthy diet and nutrition, then comes the social interaction, ample sleep and relaxation, and control of the vascular risk factors. Some ASA and AHA, means American Stroke Association and American Heart Associations, has given some life's simple 7 steps which you should follow to prevent or treat these disorders, like non-smoking, decrease and increasing the physical activity, healthy diet, appropriate body mass index maintenance, that means maintaining the good weight and decreasing the obesity, blood pressure maintenance, total cholesterol and blood glucose level maintenance. These are some of the 7 pillars. So what can you do to protect the brain health? Actions that may help are: take care of your health, eat healthy foods, be active, learn new things, connect with your family, friends, and communities. See, loneliness may also lead to majority of the disorders like depression and many of the disorders which may be harmful to the patient's quality of life. Some of the preventive measures which is very important is eating healthily. Means healthy foods is very important, like eating a good portion of fruits, vegetables, whole grains, lean meats, fish and poultry, low fat or non-fat dairy products, low solid fat, sugar and salt, and adequate fluids. Maintaining hydration is also very important. So the next thing is keep moving, get moving. That is what our elders have teached us from ages. That means physical activity may reduce the risk of diabetes, hypertension, heart disease, depression, and stroke. It prevents the falls, improve the connections among the brain cells. So if you move around, if you do the physical activity at least 150 minutes per week or 30 minutes per day, it is going to release the chemicals in the brain called as the encephalins and also endorphins. Endorphins will make you very energetic, and encephalins make you motivated. You should keep your mind active. How you keep that? Do mentally stimulating activities, read the books, magazines, play games, learn new things, take or teach the classes to the students, be social through work or volunteering. Stay connected. Connecting among the friends and socialization is also very important. What can you do today? That is very important. Take a small step for preventing the brain disorders by doing all the activities what I told you, like maintaining the proper sleep, eating good healthy foods, physical activity, and avoiding the junk foods. These are the things which you should remember. Now, I would request Dr. Kishore Kota to update about the what are the things which can help in modulating the child's brain in leading to a healthy brain development.
Yeah, thank you, Dr. Mansudan. So today we are speaking about the World Brain Day. So the development of brain starts right from the womb, that during the pregnancy, that is from 6 to 8 weeks of pregnancy. So it is very important to nurture the brain right from the beginning and in the pregnancy. So it is very important the mother takes care of her, have proper nutrition, healthy diet, and avoid infections and other toxins like alcohol, smoking, and other things to give a child a healthy brain. So the child's brain development starts from the womb and continues early childhood, infancy, early childhood, and adolescent. So it is very important to nurture the brain health from the beginning of the life. One of the most important thing is it's about caring the child. It is very important the parents, caregivers, or people handling the children give them a safe and protective environment, so the mental health is very good and they are the foundation for future of our nation. So it is important to give them sufficient nutrition which is rich in like B12, B6, folate and other micronutrients, and also love and care and protective environment for the brain to grow better. Children are born ready to learn right from the beginning and there are many ways to learn. So it is always important for the child caregivers, mostly the parents, should speak to their children, play with them, say stories, spend time with them for the healthy development of the brain. The more the negative impacts they have, it hampers the brain growth and development. Also, it is very important them to keep them very active, and very important is the reduce the screen time. Nowadays, children are addicted to screens, mobiles, laptops, iPads, TVs and other things which impair a lot of social communication and other things, and they become very hyperactive, and there are various other issues. So, to have a healthy brain, it is very important for them to go out and play, have a good sleep, have a healthy diet and avoid junk foods, and have a nice parental and child relationship.
Well said, Dr. Kishore. You told that children are born ready to learn and have skills, many more skills to learn over coming many years. And that's what the learning, what you told, it is the one which is going to affect their memory. It is also going to improve their thinking, thoughts, and also emotions. So they have to keep occupied in many of the times in the physical activity, mental activity, and also emotionally they should be stable. And in the end, I would like to thank our SPARSH Hospital, Yeshwantpur management, and also all the hospital staffs and doctors, and also the Indian Academy of Neurology for giving this opportunity to do the World Brain Day and to create awareness among the general public. Thank you.
Thank you.